Sam, do you want to start right at noon or give folks a minute or two to?
Yeah, if you want to start in just a
minute or two?
So,
okay. Just give me the nod.
Mm-hmm.
Well, good afternoon, everyone. Welcome to our Build Your Armor series, which today is our inaugural kickoff of Build Your Armor. And my name is Mark Pettus, and I am the Director of Population Health and Community Care at Berkshire Health Systems. And I'm also the physician lead for our wellness initiatives, the health system and community-wide. And on behalf of the wellness team, I'm really pleased to introduce you to what I think will be a very informative, a very helpful series and news to use during these most extraordinary times. And as we were planning the content for this series, we were attempting to balance what I know is a bit of overwhelming information overload out there, but trying to balance that with some really pragmatic information. And today, my colleague, Dr. Jim Lederer, who's our Chief Quality Officer and our Chief Medical Officer for Berkshire Health Systems, and I are going to be giving you an overview of COVID-19. This is an up-to-date overview of the status of COVID-19 in Berkshire County. There's a remarkable story here that I will let Dr. Lederer share with you in a moment. With some very good data that can just give you a sense of what's happening in our ecosystem. And that's really what's most important to all of us here in the Berkshires. And then I'm going to just give you a layout of the series over the next several weeks that really has our A-team that will be presenting every Wednesday. And of course, this will be archived information that will build on things that you can do in your lifestyle that can really enhance your resiliency. And so next week, I will be sharing some state-of-the-art research with you. We'll be focusing largely on nutrition and what's hot in nutrition and health, and some strategies to prevent and in some instances even reverse what may be health issues that you're confronting or your loved ones may be confronting. In week 3, Beth Piantoni from our wellness team will be giving you some tips on building exercise into your day-to-day routine. Marcy Simons from our pastoral care program will talk about spirituality, right? Finding blessings during these extraordinary times. And as you can see from these topics, all that we do in our wellness work is holistic and integrative. And so all of these dimensions, of course, are central to the experience of being human and navigating these interesting times. And so Marcy will reflect on that. Dr. Jack Ringler, who's the medical director of our sleep center, will provide an overview of sleep, also an essential pillar of health and resilience. Lisa Laramie will be talking about the healing power of nature. And here in the Berkshires, one of the greatest resources we have is the amazing terrain and ecology that we all live, work, and play in. And as it turns out, there are some powerful therapeutic benefits of being outdoors and taking full advantage of that Lisa will review. The extraordinary Maria Sirwa, who's a clinical psychologist and who's a national expert on positive psychology, will share a terrific topic on staying positive during uncertain times. Anyone who's ever heard Maria will come away inspired and motivated, and that will be on week 6. Mackenzie Evangelisto from our wellness team will talk about some basic hygiene habits and even things like how do you clean your mask? What are some ideal things that can help you just sort of maintain what's necessary from a public health perspective in a way that can be fun, enjoyable, and health promoting. And then lastly, Dr. Alex Sabo, that many of you in the Berkshires know. Alex is our Director of Medical Education, also the director of our psychiatry residency program, and he will close our series on cultivating your resilience. So this is a really state-of-the-art series, and we are really delighted to be sharing it with you. All of our slides and the slide decks that we share with you should be available to you. And I know that Maureen Daniels, the director of our wellness program, has a list, and we'll make sure that anything that we share will be forwarded to you for your review. And so it may be the understatement of the year that for the last 6 months or so, we've all been navigating the perfect storm. And it's been a long storm. Unlike some that come and go and wreak havoc over a short period of time, this has challenged everyone over many, many months. And whether it's a health concern that you may be confronting, perhaps a risk of COVID, maybe you're a caregiver for a loved one who may be older and at greater risk, or in one of our local nursing home facilities, maybe your job has been put in jeopardy. We've had just profound sociocultural challenges. And so this really has felt like the perfect storm of challenge. And both Dr. Lederer and I today will emphasize that there's so much that we can be doing to navigate this perfect storm in a way that can not only leave us resilient, but not feeling too burnt out from it all, because it's so easy to find yourself in that place, as I know I have on many an occasion. So I'm going to hand my laptop over to Dr. Lederer, who I say is relatively new to our healthcare system and is bringing just tremendous leadership. But pretty much this pandemic started soon after Dr. Lederer's arrival, and he's just manifest extraordinary leadership at every level of our system, the complexity, how we've adapted to this. And he's going to share data with you and a story that I believe is one of the most remarkable stories in the state and maybe in our region in terms of what a comprehensive integrated approach to a pandemic can look like. And so, Jim, I'm going to hand that over to you.
Thank you, Mark. So I guess it's afternoon. Good afternoon, everybody. And I thought what I'd like to do is really share with you where we were, how we came to be where we are today, and what we expect for tomorrow. Because as Mark pointed out, I joined Berkshire Health System January 13th, and it was March 8th or 9th, I think, that our first truly manifest patient was documented with COVID-19. So here we are, 6 months later, and yet the world has markedly changed for us in the clinical perspective with how to manage COVID, how to diagnose COVID, but also for our community. Things just aren't the same. You know, we have businesses that are no longer open, people who are no longer able to, take care of their families the way that we would hope everyone would be able to. And it's been a big change for all of us, certainly personally here at Berkshire Health Systems, whether it's childcare issues or a spouse whose job was affected, while ours here may not be. This has been far-reaching, and I think it's important just to understand that while it's been a tough 6 months, I think the next 6 months, I'll give you the punchline right now. The next 6 months are going to be better because we've learned so much. So in that first week of March, when we had several patients present with illnesses consistent with COVID-19, it was a little out of the norm because everyone nationally was telling us it's a travel history. You have to go overseas to a high-risk area and get exposed and bring it back, and that's who you should be looking for, and that's what they told us. That's what we should be looking for. And that was not our first set of patients. They were local Berkshire County residents, for the most part, really small town residents, not Pittsfield per se. And there was absolutely no known exposure history or travel history. And so we had a community outbreak before community outbreaks were appreciated. And over that first few weeks, because we didn't necessarily have good coordination between us and the state at that time, we had to really force our issue to get tests done because we didn't have the classic test or the classic exposure where the patient had a travel history or the patient had an exposure history. So why are you testing them? You don't need to do that. You know, this is probably something else. And our infectious disease docs and ICU docs said, no, this looks an awful lot like COVID. We need to get this test done. And so, you know, we learned a lot in those early days, but we also had some early exposures because we didn't know when to expect the first COVID patients. They showed up before we really had an inkling of what COVID looked like and how we should monitor ourselves. They showed up before we could get the testing done. And so ultimately in that first few weeks, we had about 220 people quarantined because of potential exposures. And that's a rough start. You know, when that's a large component of our daily workforce to be quarantined. And we had to scurry and manage to, you know, find replacements and temporary staff and do what we could to really address the need. And we did. And we got through that first few weeks, and things little by little started to become better defined across the country. And we learned about how to be a low risk organization. And so not long thereafter, we started our masking of all employees, whether you're in a clinical situation or, you know, a support situation, masking of all patients and visitors, and, you know, an expectation that this is what we must do. We didn't have the data firmly yet to prove that it would be so highly effective, but we were told that this is the best science that we know today, and this is what we need to do, so we did it. And all of us started wearing our masks. I'm speaking to you now without one, so you can see the animation in my face when I talk about this topic, which is, you know, so really this is a fun topic because who would have ever guessed we'd be here? But we do wear our masks. And I'd like to, to share that let's now kind of step forward through the months rather quickly. Over the course of those first 6 months, from the early week of March until current, we admitted about 115 total COVID patients to the hospital. We had about 20, 25, 26 of those admitted into the ICU. The rest were all admitted on the general medical wards. So that's our 115 or so patients that came in. If it had been a normal year and there hadn't been this national kind of alert and this fear really of what's taking place, we would have absorbed those 100 patients without blinking an eye. So it was not an overwhelming surge of patients that we had to face. It was really an overwhelming surge of from a healthcare perspective, ignorance. We didn't know what to expect. We didn't know when to expect it. We didn't know what we would be seeing. We didn't know how long this would last. We didn't know anything when this first came out. All it was to us at the time was just a little something taking place in China. And it probably won't, you know, as we were told then, probably won't affect us here, but it certainly did. So that roughly 15 patients admitted over the last 6 months. We haven't had an inpatient here, maybe just a few, 2 or 3 over the last 4 to 6 weeks. So our numbers are markedly down. Now, at the same time, you know, those patients that were admitted, they had quite a long duration of stay. And so it was important that we continue to wear our masks, our eye protection, the masking of the patients and the visitors. Masking took place whether it was in radiology or the ambulatory clinics or upstairs on the floors or in our surgical suites. You know, masking was important for patients and staff. And when we think about that early 200 furloughed or quarantined employees, it was a rare few that were ultimately possibly exposed that became positive. We had just a handful, and even those, it wasn't clear where their exposure lay. Was it in the community? Was it with the patients here? But it was less than 5. We had I know a resident exposed, and possibly someone exposed into that resident. But there was not an overwhelming transmission between patients and staff, nor between staff and the patients with this masking protocol. And we really have had extremely rare numbers occurring only in those first few weeks, and nothing of significance since then. Now, some of us have been out in the community and we've had exposures there. And once our testing tent was up and running, we were able to kind of qualitatively assess how we've done with that exposure and what's taking place. So I want to stress that masking works. It's now been proven in the peer review literature that masking works. If we have dual masking in our interface with folks throughout the day, it keeps us very low risk for transmission, whether I'm sick and could transmit to you, or whether you're sick and can transmit to me. If both of us are masked, it goes a long way toward containing those respiratory particles and breaking the transmission. Being out of doors in a well-ventilated area, that helps. Maintaining our 6-foot distance, that helps. But for us in this community, in the hospital setting, in the clinic setting, masking of our patients and masking of our staff is the #1 way that we will continue to be able to do what we need to do to provide care to our community without risk to ourselves. And so, that was one of our key learnings. And so why I'm so hopeful for the next 6 months is because these are the things we're going to continue. This is how we're going to behave for some time now. It's not clear, even if the governor were to say totally abandon his guidances and say you can return to normal. That may be the community's return to normal, but I think healthcare, until we have an effective, well-distributed, well-documented vaccine for protection, we're going to have to continue to protect ourselves and our patients with masking here in the healthcare setting. Another thing we learned is that initially many of our patients, as I pointed out, 1/5 were in the ICU setting, and we're very ill and ill to the point of we documented 18 deaths here at Berkshire Medical Center. And so, that's a significant number when you think through the total number of COVID positive patients we had. That's approaching a 20% mortality, and that's nothing we would like to replicate ever again. But it was a significant illness, and our ICU doctors quickly learned how best to care for patients with proning of patients for better aeration of lung fields. We've come to learn that Decadron provides significant immune modulatory effects and lessens some of the severe complications of COVID, particularly in the lungs. And so we now routinely use Decadron for the management of patients, whether they're severely ill or not. It's been shown to be beneficial. Remdesivir is now an agent approved for COVID patients, and it has efficacy and is used in the mild to moderate, even the severe cases. We were using some tocilizumab, and it's something the rheumatologists know for some of their autoimmune diseases. It's been actually proven not to work. So what we've learned over these past 6 months is how to better manage our patients, such that of the last, 10 or 15, 20 patients, they've all been med-surg admissions. They've not been ICU level patients. And so moving forward, this is the other aspect of kind of the insight into what we can expect in the next 6 months, is that more of our patients will be med-surg because more of our therapies will be enacted earlier, and we'll be able to better manage our patients with less severe complications. Additionally, we have a lot better testing than we had back in the early part of this. We're not where we want to be. We're probably never going to feel comfortable with the testing strategy we have because we're limited, but we're getting the job done. And we're able to test all of our inpatients. We're able to test all of our pre-op patients. We're able to test the ED visits and urgent care, and we're looking for more testing platforms, antigen tests you've heard about. We're on the list to try and obtain some of those machines, the 5-minute quick turnaround machines. But because of testing, we know what the community looks like. That's why what happened in March is unlikely to ever happen like that again, because with any positive test, we have contact tracing with the health department. And they're going out making phone calls to those known positive individuals to see, where were you yesterday and the day before? Who were you around? What gatherings were you a part of? Who was present at those gatherings? Who did you have close contact with? Did you have any visitors? And so with that, just questioning of known positives, we're able to isolate and test those high-risk exposed individuals so that then they won't proceed on if they were to become ill and infect even more. So we're breaking transmission earlier. We're keeping a closer watch on the total numbers of positive. And those are the numbers here in a second that I'm going to show you, so you get an inkling of what's out there and how the rest of the community looks, because it's those numbers that help us predict and prepare for what might come in the next few weeks or months, or even out to the next year. Is data, from a COVID perspective, data is king. It helps us better manage and better anticipate where we are today and where we're going tomorrow. So with that, I'm going to pull up the first slide. This is the Berkshire County COVID-19 dashboard that our data team has developed. And you can see it's got a lot of information packed into here. On the top left is how the state assesses the communities and whether or not they're on a good standing, kind of middle ground where things could be better, or in the red sections, the red boxes you see there in the top left, those are communities that still have high risks of transmission and high incidence numbers of patients. And so this comes out, and it's a 2-week kind of running flow of the state's incidence of exposure. And I'll show you something a little more fine-tuned from that. But as you can see, the whole left-hand side of Massachusetts, which is Berkshire County, is gray. And what gray means is that there are 4 or less documented cases. The green is there are less than 4 cases per 1,000. And then the other numbers, the other colors are higher numbers. So we're able to keep close track of that. On the right-hand side at the top, you can see kind of our COVID-19 current inpatients. And oftentimes when you see an acute care, these are folks who've been here for some time or who are known positive and are readmitted. So they may be actually coming in for another reason, but because they're in our Expanse EMR, we kind of take a little bit extra precaution and use the isolation precautions to manage those folks, though they may not be as infectious as they were earlier in the course of their infection. And so, you can see just one in-house. Cumulatively on the right-hand column, you can see hospitalized to date, 68 in acute care, 38 made it to critical care. Ventilated was 20. So we actually had a higher critical care number than I gave you earlier. It's 36%, but our vent patients were 20 out of those. So it's a very high intubation rate. As I said, our hospital deaths and our readmission rate for COVID is higher than what we normally see here at Berkshire. We're around 14% for readmissions, and the COVID readmissions are 22%. When you look at the work we've done, that middle section, the Berkshire County totals, we've done 3,300 antibody tests, of which 8.4% are positive. If you split that positivity rate out, if you talk about the community, it's about 10% antibody positivity rate. And that's a good marker for probably what took place in our community, that 10% of the community, of the county, may have experienced a COVID infection, whether they were symptomatic or not, but 10% would be the total, because an antibody test is really like a survey. You're just going out, kind of assessing people and they're not self-selecting as they did with the nasal test. So this is just an all-comers, just test where we are. But the flip side of this is while the community was 10%, of those folks here who are Berkshire Health employees, the positivity rate was 3%. So again, it's more data for me to say that masking of ourselves, masking of our patients at risk is a way to cut your risk, from the community levels of transmission to much safer and much lower hospital levels of potential transmission. And as I said, from pure count numbers, we have a hard time, getting more than just a handful of patient to staff transmissions, and we really don't know of any staff to patient transmissions, or patient to patient transmissions for that matter. So masking works. When we looked at what we early did, which was start up our testing tent, we've done 35,000 tests so far. That's, the county population is just around 125,000. So that's over a fourth of all Berkshire counties been tested at least once. 23,000 unique patients. So there were some multiples there. Our PCR positivity rate is 2.7% total. It was much higher in the early days, and it has, remained very low since. And in the last 14 days, our positivity rate has only been 0.8%. We've done 4,000 tests and only 0.8% positive. We've only had the 106 hospitalized, 477 were known positive patients, and they were in the community. And in Berkshire County, there were 39 associated deaths. Some of these were nursing home patients, some of these were patients with significant comorbidities, and COVID was another element that that caused their demise. But if you just think through this, with 120,000 patients, we had roughly almost 600 total COVID positive patients since March. Only right at 100 who were, or a little over 100 who were hospitalized. And we learned a lot, and we've done a lot since then. And so, these are the things that we know we have to continue, because this is our only way of practicing safely, treating patients safely, and expecting to be able to protect ourselves from the potential future COVID patients if they are to, if we see a surge, which many people think will be less a surge and more just a slight increase in numbers, but a more protracted event as the fall comes. So the state has put out now a COVID dashboard by county, and as you can see here, they update it weekly. It's a 2-week running tally. It looks at, here is the statewide dashboard. We've had 4,000 total Massachusetts patients COVID positive for a case rate of 4.2 per 100,000. We've done almost 500,000 tests, which is incredible. And well, that's for just 2 weeks. So that's multiply that by 52. That's an incredible number of tests being done here. And our percent positivity is only 1.07%. So, we're in a definite downward trend. And if you look at the national news, Massachusetts is one of those states that just stands out. We've had an outbreak, we've held our ground, we've done the things that we're supposed to do, and we're in great situation and a great position for managing the future effectively. Because I think the one thing that struck me, new to Massachusetts and not wanting to run afoul of the governor's travel, our first beach trip ever was to the Cape. And that was just 2 weeks ago. And at the Cape, no different than anywhere we drove through and stopped for gas or for something to eat. Everyone wears masks. Everyone is social distancing. Um, on the Cape, you would imagine that there are lots of small little shops. Sometimes the limit was one. One person could go in the shop at a time because it was so small that in order to social distance, they had a line and the little decals on the ground to show you where to stand. And I didn't see anybody here in Pittsfield, anyone that we've ever come across as we've done our normal shopping and the things we're supposed to do, or anywhere at the Cape that wasn't following those same rules and those same guidelines. And I think that speaks well to the Massachusetts mentality of let's protect ourselves, but let's protect our neighbors. And I think as long as we continue to keep that in our mind and in the forefront, we're going to be in just perfect position to weather this storm and come through it well, and safe and happy. From a Berkshire County perspective, this was the last 2 weeks, 30 confirmed cases, a case rate of 1.7. 8,000 tests were done over that 2-week period, and the overall percent positivity lower than the state at 0.4, and no deaths in these last 2 weeks. So we're able to follow and track this data closely, and this is how we really position ourselves to be aware of what's coming, whether there is a small surge being recognized, whether we need to be alert to that. Helps us prepare for continuing our PPE purchases and all the things we need to do. So I think this data set is available to you. You can go to the Massachusetts website and you can get access. Here's kind of a tabular form showing a bar graph of 2-week increments. So on the whole, it looks like we've been somewhere between 12 and 30. I wouldn't claim that we're in a bad state today at 30. Just something that this is what we do. We assess the data. We constantly try and take a look and see where we are. And if you look at the average incidence per 100,000, kind of the metric that the state uses for risk, we're at 1.7, which is below the 4 trigger. So we're a green area for that. And that's how we continue to assess and manage ourselves. As of 9/8, we've had 622 positive tests. If we exclude SNF employees and patients, 609. In the last 14 days, we've had 18 positive. In the last 10 days, we've only had 8 positive. So there's a low level of transmission out there in the community. And that's what has some of us concerned about when school starts back. But many of the school systems have already gone to either a hybrid or totally remote. And so while that's difficult for for you as employees who have daycare needs and childcare needs, it does help prevent spread within the childhood population. And I think I saw the figure of, as of last week, there were over 500,000 documented pediatric positive patients nationwide. So this is not something that the administration was saying that kids don't get sick. Kids get sick. Kids do get sick, and we want to protect our community's children as best we can. And I think the school systems are taking the proper approaches, and we have a tight coordination with the Department of Public Health nurses. Dr. Doyle serves as our medical director for the county and works closely with all the public health nurses from North Adams to Great Barrington and all in between. And with that, I think that's one of the reasons why the next surge, if there is one, will be minimized, if a surge at all, because we have such close contacts to our Department of Public Health. We have such good reporting, and we're getting good turnaround from Quest and the tests we're getting. And our doctors now know what to do in managing these patients. So I think all positive signs for us moving forward. If you like dot graphs, here's one, a line graph that just shows where we were, and you can see the early late parts of March and early parts of April, sometimes as high as 40 patients on that collection date, whereas recently, much lower numbers. And it shows we got rapid control of this, and we've held and kept good control from a community perspective. this is not just Berkshire, Maine, or Fairview. This is the county and all the work that Dr. Doyle and the Department of Public Health is doing to help mitigate and minimize the transmission of COVID in our community. And then again, a kind of a rate of positivity. Early on, you know, we had almost everybody tested was positive. And of late, you know, we're well under, as I said, we're at 0.8%. So looking very good from that regard. And then just another COVID positive test rate and collection dates. So those are just, that's where we are today. And I'll hand this back while I kind of finish my thoughts here. It's important to understand that we know so much more than we did. And we are more integrated than we were when we first started. You know, Fairview, the BMC, the skilled nursing facilities with Dr. Burt and, you know, his long-term care units, the Department of Public Health, the school systems, Pittsfield, you know, city itself, and we've been in connection with and speak to mayors, you know, in other cities across Berkshire County. This, you know, this puts us in a unique position because we're all aligned in the same direction. In some of the markets I've been in prior organizations, you know, there weren't just one competitor, there were 4 competitors. And so, you know, when everyone can point the finger at who's going to fix the problem or whose problem is it really, nothing gets done. Here, this is our community, and we know that for us to get things done, we're going to have to do it together. We're going to have to do it in collaboration and in support of one another. And I think what we've learned and the way we've approached this, we've set and anchored, you know, those processes deeply, and they're now a part of our being. They're how we're going to do work moving forward. And I don't see anything that we're ill prepared for. And we have a supportive leadership team, and we have a supportive board of directors, and we have a supportive community and supportive state legislators who also we work very closely with. So I think all that told means that you know, if you have to be anywhere in Massachusetts, you ought to think about coming to Berkshire County, because we've figured it out. We've done a lot. We've coordinated a lot. We've, you know, collaborated a lot, and we're going to continue to do this moving forward. So from the purely, you know, from the perspective of what do I need to do to protect myself, is keep doing all those things you've been doing, because you've been doing a great job. You've been protecting yourselves, your colleagues, and your patients. And for that, I just say thank you.
You actually have a question from an anonymous attendee. Do you know where these new cases are coming from?
Well, we do. Interestingly, I think over the weekend and into the early part of this week, we identified 5 new cases. 2 of those, one of those was in a person previously known to be positive in April who returned positive. So that gives us some concern that, as were pointed out in the national news, we don't know how long the immunity lasts. You know, this is 6 months after that person's first positive test. And if this is a repeat clinical symptom, you know, and set of circumstances, then it means that maybe we don't have the long-lived immunity that we would like. But it was a local person. And then we had another local person, but then we had a family of 3. And that family of 3 came from Miami, Florida. And so that's why the governor did what he did. That's why he said that there are safe places to visit and there are not safe places to visit. And if you go to a not safe place, that's why you need to have a test, either prior to your return so that you can safely reintegrate into the community, or, you know, immediately after your return. And if you don't get a test, you really need to quarantine for 14 days, which is the incubation period of the virus. So, you know, we're seeing still a large proportion of our positive cases in the last few weeks have been from people from out of state or out of our community.
Great. Thank you so much, Jim, for that overview. And that's as data specific and overview as one will ever find. And hopefully it will provide some reassurance that while COVID will continue to be a concern for everyone, particularly those that may be at greater risk, we really do live in a place where the ecosystem is one that we can manage in a bit more of a coordinated way. Hard to do in a big city, large metropolitan, population dense area. So in the short time that we have remaining, and I know many of you are in the midst of busy days, this is probably your lunch break, but I wanted to just very briefly move beyond the mask, if you will. And Jim certainly reiterated, and the data speaks for itself, of the importance of all of these public health measures and the importance of keeping your foot on the gas in a continuous way. But we've learned a lot about things beyond just public health measures that we know are critically important in rendering one's immune resilience and armor in a much stronger way. And looking at the curriculum over the next several weeks, we're going to be looking beyond the mask. And one of the many things that in the healthcare community that we have known for a very long time is that there are certain health conditions that can render someone's immune system weaker and put them at greater risk for severity of complications. And influenza has taught us a lot about that through the years, and COVID certainly no exception. But I want to introduce this concept of immune or metabolic resilience. And so what we will see over the next several weeks is that what you eat, what is on the end of your fork, or what is in the glass, the beverage that you're about to consume, will either enhance your metabolic risk or will give you more metabolic resiliency. We will look at that in a little more detail next week. We know that meal timing may actually have a dramatic impact. And again, I'll talk a little bit about intermittent fasting and time-restricted eating. These are powerful lifestyle strategies that upregulate or make a bit more robust one's immune surveillance. And so the concept that every choice that you make, how you eat, how you move, how you sleep, how you interpret and respond to the stressors in your life, of which there are many, how connected you are to individuals that love you, that support you, that you feel safe and supported by, how much meaning and purpose you cultivate in your work, love, and play. These are all attributes of life that have powerful impact on one's metabolic landscape. And so a lot of this series, while it may be addressing building your armor from the perspective of a pandemic, I would make the case to you that no matter what your health trajectory may be, we are learning that most of what influences how long we live and the quality of life along the way has less to do with the genes we inherited from mom and dad and more to do with the relationship between each choice that we make in the environments that we are in, and indeed that unique genetic predisposition. And so this is a much more empowering model of understanding of human biology and human health that certainly Dr. Lederer and I did not learn in medical school. Epigenetics, the understanding of how environment influences your DNA, didn't exist. We knew very little about the microbiome, this ecosystem of organisms that are very much a part of who you are. And as it turns out, the qualities of that biome ecosystem, the diversity, the balance, and the ways in which lifestyle choices affect that will have a powerful impact on how resilient you are. And so that just sets the stage for what we'll be covering over the next several weeks. And this is just a reminder of this revolutionary science of epigenetics, how the outside gets inside. As it turns out, many of the things that we worry about in our health, why they may be influenced by our genetics, those genes can be influenced, can be turned on, can be turned down through lifestyle. And so the same DNA, the same book of life, can have an infinite possible ways to manifest over one's life, depending on the nature and quality of that environment and the choices made possible within that environment. So this is a very powerful construct that we will be developing a bit more in the weeks ahead. What we have learned from COVID, and this is a recent data from the CDC, is 90% or greater of those individuals hospitalized with COVID, those higher risks that Dr. Lederer referred to, some of whom required critical care, some of whom required ventilation, some of whom succumbed to the infection, 90% or greater of those individuals who became very sick from this had at least one or more chronic health condition. About 50% had high blood pressure, about 50% were obese. And we know that this is, hypertension affects, at least a third to a half of all Americans. And as you get older, that prevalence is even higher. We know that 70% of Americans are overweight, about 40% are obese. If you look at lung disease, about a third of these individuals who became very sick from COVID had lung disease. Almost a third were diabetic. And then we know many of these people had cardiovascular disease. Now in healthcare, we call these cardiometabolic risk factors. And what we know about these cardiometabolic risk factors is that they can be modulated. They can be reduced. If you're a diabetic, you don't have to accept that as a genetic predisposition over which you're left with medication for control. And yes, medications may be important, but how you eat, how you move, how you sleep, how you interpret and respond to stress in your life, how connected you are to loving networks of individuals, how much meaning and purpose you cultivate in your work, love, and play. This is what ultimately will drive the metabolic risks, which ultimately will drive your trajectory, whether that is a response to an exposure like COVID, or whether it might be your long-term risk of diabetes or heart disease or Alzheimer's. These same risk factors are at play for all chronic complex health conditions. And lifestyle is really where the rubber meets the road here. More data. This was some of the original data from China and other countries now, and certainly true here in the US. If you looked at individuals who died from COVID around the world, those that had normal blood sugars have about a 99% survival rate. 99 out of 100 with normal blood sugar will survive or have very limited complication. On the other hand, if your sugars are not well controlled, you're looking at a 10 to 11 times higher risk. That's an order of magnitude. If there were any medication that could reduce your risk of mortality or morbidity by 90 to 95%, that would be front page news. And what I'm going to suggest to you is that we will be covering lifestyle science and evidence that the extent to which can be applied in a more effective way in one's life can dramatically reduce your risk. These are huge risk reductions. And so I leave you with a quote from Viktor Frankel, who, as many of you know, is a Holocaust survivor and an extraordinary human being who obviously endured some of the most horrific conditions that any human being on the planet could ever endure. And Viktor Frankel once said, "Everything can be taken from a man or a woman, but one thing, the last of the human freedoms, to choose one's attitude in any given set of circumstances, to choose one's own way." And so it is very important that we not be drawn into a vortex that might leave us thinking that we are innocent victims over an organism, a virus that we can't see, over which we have very little control. And while it's true that there are some aspects of the pandemic that we cannot control, there are many things we can do in any moment, in any day, that can very much modify our risks and ultimately our experience of life. And whether it's the types of foods that we're eating, and we'll talk about that next week, whether it's meal timing, whether it's some basic sleep hygiene techniques that Dr. Ringler will review, whether it is some powerful and effective ways of reframing how you interpret and respond to the complex and stressful conditions of your life. Maria Sirwa and Alex Sabo will give you some powerful tools that in any moment will help you reinterpret the conditions that you are in. Powerful stuff. Lisa Laramie will help share with you why it is that sunshine and a walk in the woods or a kayak on the lake or just sitting on your front lawn is a powerful health promoting endeavor. And so we'll look at this in a lot more detail. As I said, I hope that you will find this good news to use in the challenging fall and winter season to come. And on behalf of both Dr. Lederer and I, and on behalf of our wellness team and the other speakers in this program, I just want to thank you for taking time out of your busy lives to register for this, to just clear your head for an hour to learn a bit more about what's happening in the amazing communities that we live in, what our health system is doing each and every day, 24/7, to be certain of the infrastructure necessary to meet any demands that may be forthcoming, and most importantly, to just share and connect with you. This is a story about community. It's a community challenge. It's also a remarkable community success story, and how we connect, how we collaborate, how we partner, how we truly become brothers and sisters in this day-to-day journey of life. So I thank you all for tuning in. I will be joining you next week for a deeper dive into some of these nutrition topics. And we thank you, and well wishes, and stay safe and be well.
We do have one question with the time left.
Yeah, we've got one question. So yeah.
From an anonymous attendee.
Yes.
Do we know if the comorbidities are the reasons for those who seem to have COVID symptoms remaining months on end?
Yeah, so the question was, and I was remiss in not thanking Sam, our technical support, making this presentation possible. The question was with respect to these comorbidities, and what do we know about them as predictors of what might be a more prolonged course? It's a superb question, and I think the data is still coming in, but it's fair to say that what we know currently is, yes, they do seem to have a significant predictive impact on how sick and how protracted one's symptoms may get. And again, I think the more we learn about this, the more we can appreciate that in any given day, we can reduce and modify our risks. It does not take 6 months or a year to reduce one's risk. You can begin to see that within days to weeks. And so we will explore that in a little more detail. Great question. Any other questions? Yeah. All right, everyone. Thanks so much for listening in. Enjoy this beautiful weather, and we will see you next week. Peace.